Have you ever wondered why two versions of the same medication can cost such different amounts? When it comes to prescriptions, one of the most common questions people have is, do I really need the brand name or can I get the generic? This one decision can make the difference between paying $10 and $100 and even more. In this module, we'll unpack what brand and generic medication means, how insurance decides which one you'll get, and what steps you can take to save money safely. Because when you understand the system, you can make informed choices that keep your care consistent and your wallet protected. All right, for this agenda, we have what brand and generic really means, how insurance influences the choices, how to ask for generics without the confusion, when a generic isn't available or covered, pro tips for saving with confidence, how generics are tested and monitored, troubleshooting common generic issues, putting it all together, the system summary, example, brand versus generic in action, and closing and next step. Have you ever wondered what makes prescription brand name or how a generic is allowed to exist? And whether it really works the same. Understanding how drugs move from patent to generics helps you see why prices changes so much. What brand and generic really means. Every medication starts as a brand name drug. The first version created and approved by the US Food and Drug Administration, FDA. The company that develops its own patent for several years, usually 20 from filing, though part of that time happens before approval. That patent means no one else can make or sell the drug during that period. It allows the manufacturer to recover the cost of research, clinical trials, and marketing. When the patents end, other approved companies can make generic versions using the same active ingredients, doses, and form like tablet or capsules. The FDA reviews generics to confirm the drug contains the same active ingredients and strength, it works the same way in the body, and it meets the same quality and safety standards. Generic drugs typically cost 80 to 85% less than their brand name version because generic manufacturers skip the research and advertising costs. The FDA requires generics to meet the same standards, purity, strength, and stability. The only differences allowed in the active ingredients are things like color, fillers, flavoring, and do not affect how the drug works. Now let's use an example. Lipitor was one of the top selling cholesterol medications in the world. When the patents expire, other companies began selling Advastatin, the FDA approved generic. Both lower cholesterol in the same way, but the average price dropped from over $100 a month to less than $10 for the same dose and results. Why does your doctor's prescription sometimes cost one price this month and another price the next, even when the drug is the same? That's because your insurance plan and its pharmacy benefit manager, PBM, plays a big part in deciding what you pay. How insurance influences choice. Even though your doctor writes the prescription, your insurance plan, through its pharmacy benefit manager, decides how much you'll pay and whether it's a brand or generic is preferred. They use a list called a formulary, a catalog of covered drugs divided into pricing tiers. Tier 1, generic, lowest cost. Tier 2, preferred brand, moderate cost. Tier 3, non-preferred brand, higher cost. Tier 4, specialary, or very high cost medication. Each tier has its own copay or coinsurance. So even if two drugs are treated the same condition, one might cost $15 while the other costs $80 depending on its tier placement. Why it matters. If your doctor prescribes a brand name drug when a generic is available, your plan may only cover the generic price, leaving you to pay the difference. That's why confirming coverage before you fill saves both time and frustration. PBMs negotiate with manufacturers and rebates and discounts. Those negotiations affect which drugs become preferred. That's why formularies can change every year, and drugs that was in tier 2 this year might move to tier 3 next year. Formularies are required to be accessible online for every health plan, and plans must notify members of major tier or coverage changes, usually once a year or at renewal. You'll see how to find and use your plan's formulary in Module 3 when we compare prices and savings tools. Do you know what to say at your appointment or the pharmacy counter to make sure you get the lowest cost version? A simple phrase can save you money without changing your treatment. How to ask for generics without the confusion. Asking for a generic is simple, but doing it the right way matters. When your doctor writes a new prescription, say, "Can you please prescribe the generic version if it's available and appropriate?" That one sentence can cut your costs dramatically. If your prescription is already at the pharmacy, ask your pharmacist, is there a generic equivalent for this medication? And can you contact my doctor to authorize the change? In most states, pharmacists can substitute a generic automatically if the doctor doesn't specify dispense as written or brand medically necessary. If that phrase is checked, they must get the doctor's approval before switching. Now, here's an example. Jasmine's doctor prescribed Crestal, a brand name cholesterol drug. At the counter, the pharmacy told her that another generic was available and covered for $10 instead of $80. With the quick call to the doctor's office, the switch was approved the same day. Every state has its own laws on generic substitution, but all allow under FDA A-rated equivalency unless the doctor prohibits it. What happens if there is no generic yet or your plan doesn't cover it? You still have more options than you think. When a generic isn't available or covered, ask your doctor about one therapeutic alternatives. These are different drugs that treat the same condition in a similar way. For example, if one blood pressure drug isn't covered, another in the same class might be. Your doctor can guide that substitution safely. 2. Manufacturer discounts or copay cards. Brand drug makers often offer savings cards that lower your copay if insurance covered the medication. You can usually find these on your manufacturer's website under patient savings or support programs. They work only for people with commercial, non-government insurance. 3. Samples or trial programs. Doctor offices often receive smaller starter packs of brand drugs. These aren't a long-term solution, but can give you time to apply for assistance or insurance approval. 4. Patient assistant programs, PAPs. Many brand name companies sponsor programs that provide free or deeply discounted medications to patients with limited income. You'll learn more about applying for these in Module 3. As of this recording, by law, drug manufacturers can't offer copay cards to Medicare or Medicaid beneficiaries, but some nonprofit foundations provide similar assistance. Do you ever wonder how to avoid these surprise pharmacy bills or sudden price jumps? Here are system-level steps that keep your costs predictable and low. Pro tips for saving with confidence. Here are some simple ways to avoid surprises and stretch your prescription dollars. 1. Check insurance formularies each year. Drug tiers and preferred options change regularly. Review your plan at open enrollment helps you avoid price jumps. 2. Compare prices. Use free apps like GoodRx, SingleCare, or your plan's own price tools to see if your insurance copay or the cash price is cheaper. Sometimes the pharmacy's direct price is lower than your insurance copay. 3. Watch for dispense as written. If your doctor marks that box, the pharmacy must give you the brand, even if the generic is cheaper. Ask if that's truly necessary or if it can be left blank. 4. Use the 90-day supplies. For maintenance drugs, many plans charge 1 copay for a 3-month supply, saving you 2 extra copays each year. Compare pharmacies. Price varies between chains, local stores, and mail order services, even with insurance. Preferred pharmacies may cost less. 6. Ask about mail orders. Mail order pharmacies are often required for certain maintenance meds. They can reduce costs but take several days to ship, so order refills early. Ask about combination pills. If you take 2 separate medications, sometimes one pill combines both. It can simplify your routine and sometimes reduce your total copay. You'll practice comparing pharmacy prices and coupon programs in Module 3, Smart Ways to Save on Prescriptions. Have you ever worried that generics might not work the same? Here's why the system ensures they meet the same standard as brand name drugs. How generics are tested and monitored. Even though this course focuses on cost and system design, it helps to know why generics are trusted. FDA oversight. Before approval, every generic must provide a bioequivalence, meaning it releases the same amount of the active ingredient into the bloodstream in the same amount of time as the brand. The FDA also inspects manufacturing sites and reviews quality reports regularly. After the generic reaches the market, both the FDA and manufacturers track reports and side effects or quality issues. If problems appear, recalls or label changes happen quickly. Over 9 in 10 prescriptions in the US are now filled with generic medications, according to the FDA and the AAM Association for Accessible Medications. Have you ever noticed your pill looks different from the last time or felt like it worked differently? Here's what's happening and how to handle it. Troubleshooting common generic issues. Even though generics are equivalent, you might notice small differences, and here's why. Color, shape, or size differences. These come from inactive ingredients like dyes, fillers, not from the active drug. Switching manufacturers. Pharmacies may change suppliers based on availability or contracts. If you have sensitives or reactions to certain dyes or fillers, ask your pharmacist to note that in your profile. And lastly, it feels different. Some people worry that the new tablet works differently. If you notice real symptom changes, talk to your doctor or pharmacist. They can verify whether another manufacturer or dosage form might work better. Generic manufacturers must meet the same quality standards as the brand manufacturers, including the FDA's current good manufacturer practices. When you step back, what's the big takeaway from brand versus generic medication? Let's connect all the moving parts you just learned. Putting it all together. System summary. Let's review what you learned so far. Brand name drugs are protected by patents. Generics use the same active ingredients once patents expired. Insurance plans and PBMs use formularies to steer you toward the lower cost covered drugs. You have power at every step. As for generics, check coverage and compare prices before paying. Saving tools like coupons, discount apps, and mail order programs stretch your budget even further. Communication among you, your prescriber, and your pharmacist prevents mistakes and delay. These skills will help you in Module 3, where we'll combine insurance benefits, coupons, and assistance programs for even bigger savings. Let's see what this really looks like in real life and how one simple question can change hundreds of dollars. Example, brand versus generic in action. Scenario 1, the brand request. Marcus' doctor prescribed Nexum for acid reflux. At the pharmacy, his copay is $85. The pharmacist mentioned a generic is available and works the same way, covered at $10. Marcus asks his doctor about switching. The doctor agrees, and Marcus saves over $900 a year. Scenario 2, the dispense as written problem. Maria's allergy medication is written as dispense as written. The brand was $125 a month. The generic would have been $15. After a quick call to the doctor's office, they removed the restriction and her costs dropped immediately. Scenario 3, new drug, no generic yet. Anthony's provider prescribes a new diabetes medication that doesn't have a generic. He asks about a savings card and learns the manufacturer offers one that caps his copay at $25. He also checks if older drugs in the same class are covered, giving him backup options when coupons expired. Each scenario shows the same principle: asking questions early, save money, and avoid frustration later. What's one thing you'll do on your next prescription? Ask for the generic, check your plan's formulary, or compare prices before paying. Choosing a generic doesn't mean settling for less. It means understanding the system and using it wisely. You can often get the same result while paying far less. In the next module, Ways to Save on Prescription, we'll combine what you learn here with the price comparison tools, pharmacy programs, and assistant resources to help you build a complete medication savings plan. I will see you in the next module. Thanks for watching.